Welcome to CHI's 2014 Annual Report. We'd like to show you our top initiatives and what they mean to the people we care for. Join us for a day in the life of Ava, one of many people on a healthcare journey with CHI. While some of the initiatives we'll show you are not yet available in every CHI market, you'll see how we're improving the health of our communities. Meet Ava. She's 65 and has hypertension or high blood pressure, a common chronic condition that can lead to serious health issues. Ava's doctor is part of a CHI primary care practice that's also a medical home. The practice staff coordinates all aspects of Ava's care. When her high blood pressure was diagnosed, Ava's doctor had her meet with a health coach. The coach taught Ava to check her blood pressure at home. Ava also met with the practice dietitian. They talked about her best food choices like vegetables, fruits, whole grains, and low-fat protein. Ava's doctor and the rest of the practice staff encourage her to be involved in her care, to ask questions, and to self-manage her hypertension. More than 70 of CHI's primary care practices are transforming into medical homes, with more on the way. Like most people with hypertension, Ava has no symptoms. That's why it's important for her to check her blood pressure every day. She enters her blood pressure readings into her health record, the same record used by her physician and other caregivers. Because Ava's blood pressure is higher than usual, it generates an alert for the doctor's office. The coach calls Ava. They talk about how to make healthy choices when dining out. Ava assures her coach that she takes her medications every day. She also follows the nutrition and exercise guidelines developed just for her. Ava finds it reassuring to hear from her coach as she manages her hypertension from day to day. Ava's daily blood pressure readings join a pool of data that CHI uses to find opportunities to improve care for everyone who has hypertension. This is one aspect of population health management. For example, the staff at Ava's medical home noticed that blood pressure levels rise before a big holiday, when stress, a contributor to hypertension, can run high. The staff uses CHI's online hypertension toolkit to find information about reducing stress. They'll send this information to consumers who have hypertension before the next big holiday. If Ava needs additional medical attention or advice, it's readily available. Her medical home is part of a clinically integrated network of providers all along the continuum of care. For example, the network includes specialists in cardiology if Ava needs a more intensive level of care to control her hypertension. Ava's network also includes a CHI hospital and a group of orthopedic surgeons. Later today, she'll visit the hospital for imaging of her shoulder, where an old injury has flared up. The images will help determine if surgical repair is needed. The providers in Ava's clinically integrated network share responsibility for her health and payment for the services they provide. Healthcare is quickly moving to value-based payment. This means health providers are no longer paid based on the number of people they see or the amount of services they provide. Instead, they are being paid based on the quality of the care and services they deliver. This means our healthcare consumers receive safe, appropriate, and effective care at reasonable cost. Value-based payment goes well with CHI's mission to improve the health of communities, not just care for people when they are ill. In some locations, CHI fills gaps in the continuum of care by becoming an insurance provider. Prominence Health is CHI's insurance subsidiary, which includes Ava's Medicare Managed Care Plan, SoundPath Health. Providing Ava with a Medicare Managed Insurance Plan gives CHI the opportunity to ensure she can receive health care at a reasonable cost and receive the preventive care she needs. To help manage her hypertension, Ava makes time for exercise every day. Today, she takes a ride on her bike. She passes a soccer field and sees her grandson. This used to be a rundown parking lot that was a gathering spot for kids who had nothing to do. With the support of a grant from the CHI Mission and Ministry Fund, it was turned into much-needed green space. Ava rides on to a market where she shops for tonight's dinner. Then, it's time for Ava's imaging appointment. CHI has 96 hospitals across the U.S. committed to improving the health of the people and communities they serve. Ava is glad to have the imaging done because the deep ache in her shoulder is becoming worse. The technician adds information about Ava's appointment to her health record, and her medical home team will have access to the results. CHI's electronic health record is now being used to improve care for 90% of its healthcare consumers. After a day of taking an active role in managing her own health and wellness, Ava has time to relax. CHI, her partner in health and wellness, remains available to her around the clock.
Hi, I'm Kevin Lofton, CEO of Catholic Health Initiatives. Through Ava's healthcare journey, you saw how our new models of care delivery improve the health of our patients and of entire communities. We're using our strengths to achieve our mission. This year, we improved the efficiency of our clinical services and business operations. We achieved more than $180 million in cost savings. CHI introduced a new brand that further unites our system. We are one organization, and we share a deep commitment to create healthy communities through bold approaches, new services, and a strong consumer focus. CHI has a new theme line, Imagine Better Health, which demonstrates our commitment to leading the way in this new era. And finally this year, we added to the CHI family. We welcome all the employees and organizations that have joined us in our Ministry of Health. The growth of CHI, our care delivery models, and our clinical expertise all create better health for the people we serve. CHI is proud to lead the way into the new era of healthy communities.